Hello everyone, I am urologist Omar Makaya. I will talk a little bit about chronic prostatitis today. Chronic prostatitis is a disease with an unknown cause, but the patient experiences a combination of complaints such as pain, urination problems, erectile dysfunction. It can have many causes. For example, it can start with a sexually transmitted disease. It can start because the patient catches a cold. In some of the patients, we can find something significant in laboratory tests. We can detect some germs either in PCR or in culture. Or we may not find anything at all. Chronic prostatitis sometimes flares up, sometimes has a mild course. The patient also receives various treatments. The patient is usually not diagnosed when they first go to the doctor, they are given a simple prescription and sent away. As the patient visits the doctor, he is diagnosed with chronic prostatitis because he cannot recover in any way. Friends, under normal conditions, chronic prostatitis requires a much more detailed treatment. Many treatment protocols are applied. From ozone therapy, antibiotic therapy, neural therapy to prostate massages, shock wave therapy, many different treatment protocols are applied. Why is ozone therapy applied in chronic prostatitis? Ozone is anti-inflammatory in its structure. In other words, it slows down the inflammation and exacerbation process. At the same time, ozone is antibacterial, so it can directly kill the microbes there. It can kill the organisms there. At the same time, ozone therapy can strengthen the patient's immune system, whether we give it through the bladder or through the rectum. Ozone therapy can be applied for many diseases, chronic diseases, autoimmune diseases. It is a simple treatment. A treatment with a very low chance of side effects. Prostate massages can also be applied in chronic prostatitis. It is a simple treatment that can be applied by massaging the prostate with a finger from the rectum, usually once or twice a week, or every day for patients coming from afar, to improve blood supply and better penetration of the treatments we give. Patients can also receive a treatment focused solely on pain, which we call neural therapy. By making procaine injections around the prostate area, the patient's pain can be reduced and the disease can be made more bearable. Apart from that, there is also shock wave therapy. With shock wave therapy, the general blood supply of the prostate can be increased. As I said, there are many treatment protocols. We sometimes need to apply all of these in combination. In some patients, only shock wave, prostate treatment and broad-spectrum antibiotics can be applied. Most of the patients come after taking many antibiotics. But when you have sexual intercourse, 5 to 6 types of organisms can come to you at the same time. For example, for mycoplasma, ureaplasma and chlamydia, we usually give Tavanic, Azitro and Tetradox treatment. We can add Novacef and Ceftriaxone, a third-generation cephalosporin. For example, let's say the patient is infected with fungus, then we can give fluconazole treatment. Or if we think that the patient has Giardia vaginalis, we need to give the patient metronidazole treatment with the market name Flagyl. These are bacterial infections. And let's say the patient develops herpes urethritis, herpes prostatitis. No antibiotic treatment I have said so far will do anything, friends. It is so difficult to diagnose the herpes urethritis, friends. Normally you need to do a herpes PCR. To do herpes PCR, you can't just take a swab from the tip of the penis and send it to PCR. You need to massage the prostate and send the fluid to PCR. Or the patient gives semen. You need to ask for PCR from the semen, which no public hospital does anyway. Private hospitals don't do it either. You need to send it to a private lab. You need to order a herpes PCR, DNA test to diagnose it. That's an expensive test. Until you do that, this patient may be infected with herpes. You can also start Valtrex treatment for the patient. Because viral infections are quite common. HPV infection is quite common. Scientific publications on HPV infection say that there is no being in the world who has not met the HPV virus. Only 10% of them develop infections, lesions, genital warts after meeting the HPV virus. Herpes is also very common, friends. Herpes is a germ that causes cold sores. It causes cold sores on the corners of our lips. But it can also cause genital sores. It can also cause herpes urethritis, urinary tract infection or prostatitis without causing genital sores. As I said, it is very difficult to diagnose herpes. Therefore, as I said, it is necessary to use Valtrex. This is a treatment that we start after evaluating the patient, which we call empirical treatment. Some of the patients who come to me may not have any history of sexual intercourse. This is a situation that we think the body creates on its own. What should be done in this case? In this case, it is sometimes necessary to change the patient's intestinal flora, friends. If the intestinal flora is bad, it starts to attract harmful substances in the food we eat into the body. If we think of an autoimmune chronic prostatitis, then it is necessary to completely renew and change the intestinal flora in patients. There is an antibiotic called Colirid. When we give this to the patient for a week, all the microbes in the intestines die. When we give a diarrhea-causing substance on top of it, we completely reset the patient's intestinal flora, the microbes living in the intestines. It is like turning the computer on and off again. And we start the patient on probiotic treatment. So we give friendly bacteria. A new intestinal flora starts to form in the patient. The patient can increase the intestinal flora with fermented foods with bacteria in them such as sauerkraut, home yogurt. Accordingly, the most preferred probiotic product is inulin, friends. Inulin can also support the bacteria in the gut. Now, is gut bacteria really that useful? In functional medicine treatment, it is one of the first treatment steps in autoimmune diseases. Changing the intestinal flora and resetting it really can provide very serious benefits in some diseases. Therefore, if I think that chronic prostatitis may be autoimmune, I definitely apply this along with other treatments. Neural therapy is one of the treatments that I get good results in patients with chronic prostatitis. It is one of the treatments I apply to patients with pain at the forefront. But friends, chronic prostatitis is a disease in which patients come to us with different complaints. Therefore, the diagnosis is already late. Some patients have erectile dysfunction problems at the forefront while some patients have complaints about urination or pain. Therefore, it is not possible to give a package treatment to every patient. It makes more sense to modify this package for patients, to try different treatment modalities, friends. So this is my approach to chronic prostate treatment. Thank you for listening. Best regards.